Thank you everyone for joining us today. My name is Tiffany Robb. I'm the Health Program Manager for the Alzheimer's Disease and Related Dementias program for the state of Idaho that is housed within the Division of Public Health. Lisa, I'll go ahead and turn it over to you to give a short introduction as well, if you'd like.
Thank you, Tiffany. I'm Lisa Anderson. I am the Public Policy Director for the Alzheimer's Association. And while we're doing introductions, I want to let you know that my father died from Alzheimer's 6 years ago, and I was caregiver for my mother up until her death last October. So I've seen it from both fronts, but I'm so excited that you're here and listening to the future of Alzheimer's disease and related dementias here in Idaho. So turn it back to you, Tiffany.
Thank you, Lisa. And a good reminder, I think that, the point of this conference is to let family caregivers know that they are not alone. And I think it was in the chat while Dr. Trump was talking and sharing her beautiful story that somebody had said that this is a great reminder of how much we all actually have in common. I too share caregiver experiences. I have served in most capacities as a long distance caregiver in my later years, where I usually fly in and stay for a couple of weeks to relieve the main caregiver who is caring for a family member. And I did do a lot of caregiving in my younger years as well. My grandfather had passed from Alzheimer's disease. It was alcohol induced, is what we were told, as well as medically induced. So there's a lot of different reasons for Alzheimer's disease, for dementias. And hopefully we can answer some of those questions today, but our main focus really is to introduce you to the future of Alzheimer's disease and related dementias in the state of Idaho. So with that, I'll go ahead and move to the next slide. Hopefully it works. Maybe. Okay, let's try that. Okay, so again, my name is Tiffany Robb, and what I'm going to talk to you specifically today is I want to introduce you to the new Alzheimer's disease and related dementias program that the state of Idaho has adopted as of this past July. So before I do, what I'd like to do is just introduce you to a few of Idaho-specific statistics or some data points. Approximately 27,000 individuals 65 years or older have a diagnosis of Alzheimer's disease. As of 2019, Idaho only had 10 geriatricians. Now, why is that important? Because we tend to rely upon our geriatricians to really help navigate the diagnosis of Alzheimer's disease or a dementia and really look at them as the specialists of what we should do next. Honestly, with 10 geriatricians, that's not going to really serve our population. So this tells us that we need to get clever with how we equip our healthcare providers. 40,000 caregivers in Idaho are caring for someone with Alzheimer's disease or dementia. Now, this is really important because we know in Idaho that a majority of our caregivers who are providing care to their loved one are also working a full or part-time job. So as you had heard in the introduction when Dr. Trump and Dr. Sarah Taves were talking, and they were discussing, or they had mentioned employer supports. This is something that's really important that we look at as a state and as caregiving community, is how we can best equip our individuals, our Idahoans who are working a full or part-time job so that they can also provide care to their loved one the best that they can. Now, I think this last bullet point is really important, and this data comes from what is called a BRFIS survey that comes out biannually, and it's for subjective cognitive decline. And what we've learned in our last report was that those individuals who were surveyed 45 years of age or older, 10.8 had reported subjective cognitive decline. Now, here's the big issue with that is many of them are not taking that concern and then talking to their healthcare professionals. And so that's the stuff that we're going to be really looking at and working on as we move forward in Idaho. What else do we know here in Idaho? We know that 40% of dementia cases could be delayed or prevented through a public health approach. Now, I want to always be careful when we use the word prevented when we talk about dementia or Alzheimer's disease, because there is nothing right now at this time that can really truly prevent Alzheimer's disease or dementia. But we're using that term loosely because there are some health choices that we could put into play that could significantly reduce our risks of dementia, or at least delaying that. And as is mentioned here on the slide, 40% of that could be done through a public health approach, and I'll go into that a little bit more. Idahoans with ADRD diagnosis, so again, ADRD is Alzheimer's disease and related dementias, and their caregivers do not know where to start once the diagnosis is given. It's very easy for persons such as myself and Lisa, who are absorbed in this environment, to think, well, people should just know they can Google and they can get resources. But as all of you know, who are family caregivers and who are doing this on a day-to-day basis, you know how overwhelming it is and how much time you do not have. And so just simply Googling something and sifting through the vast resources that are available to you online is not a luxury that many of you can take, or many of our caregivers can take. And so we really need to figure out how we can create a centralized way for individuals to know, where do I go to start and how do I take that first step? And which first step is going to be the best first step for me and my person who has their diagnoses. We also know that in Idaho, there are a bunch of great efforts that are happening all across our state, whether those are through support groups conducted through the Alzheimer's Association or associations throughout our state. Maybe those are caregiver support groups through provided through Legacy Corps, or maybe those are caregiver support groups that are provided through our local faith-based communities, universities, in our senior centers. Maybe they're provided, those supports are also provided just with our healthcare professionals. The issue that we have, though, is that there's no centralized location to kind of collect what's going on here in Idaho. And why is that important? Because we have to be clever about the way that we tackle this disease, help our Idahoans, but also utilize the resources that are available to us. We need to be most efficient with our money or our dollars that we do have available. And if there's something great happening in Rupert, then we'd like to be able to know about that so that we can share it with another like community that maybe can actually adopt that and have the same successes. And so that's a big thing that we really want to look at. Idaho, we also know, has an influx of people 65 years of age and older. This is not uncommon across the state or across the globe. We have baby boomers who are aging, and with that comes risk of dementia as we age. And so what we know in Idaho is that we are not equipped to handle the aging population and the influx of ADRD that we're looking to be taking on. So with these things, as I said, there are a lot of individuals or a lot of things that have been going on throughout our state for a long time. And that all has happened pre-2020. But I want to point out the things that have happened just recently that have spearheaded where I am today. So pre-2020, again, a lot of great things have happened separately and kind of in silos a little bit, and not due to anyone's fault, but due to capacity, due to lack of funding, due to all the things that be. But a group had been consistently working on trying to figure out how to address Alzheimer's disease and related dementias for our state. And their voices were loud, and they continued and got together or continued to meet. In 2020 had worked, or actually 2019, had pulled together proposal and brought that to our joint oversight committee for approval of a state evaluation that was completed by the OPE, or the Office of Performance and Evaluation. That report was completed and then in 2020, and then was presented in 2021. Now, I like to take a moment here, and in my role specifically, I'm not allowed to go out and impact policies per se. I'm allowed to educate, but I want to point out that all that work that had happened pre-2020 for this specific joint oversight committee approval and stuff was a lot of work by a lot of advocates throughout Idaho who helped make this happen in partnership with the Department of Health and Welfare's group, who were working to get funding. And in 2021, that OPE report was presented to our Idaho legislators, and the Idaho legislators, as well as with the governor's blessing, had designated specific state dollars to create an Alzheimer's disease and related dementias public health program, which is why I'm here today talking with you. So why public health? I want to take a moment just to introduce what public health is. This time of COVID has definitely made public health specialists of a lot of us, but I want to go back to the definition. The definition of public health is the science and art of preventing disease, prolonging life, and promoting health through an organized community effort. Now, why is that important? Because with this new program, with Alzheimer's disease and related dementias being housed within the Division of Public Health, we work amongst our community members throughout Idaho to figure out how we're going to build this statewide program to address Alzheimer's disease and related dementias. The other part of this is preventing disease. Well, we know that we cannot prevent Alzheimer's. We can significantly reduce risks of dementia. And so that's going to be a big part that we're going to focus on, is educating our community members on what we can do to help create healthier brains for the long run as we age. And then prolonging life is something that's very important to us, because the reality is a person with dementia can still have a good life. We've just got to set them up for that success. And in some cases, in a lot of cases, we've not set our individuals with Alzheimer's disease and related dementias, nor their caregivers, up for success as they travel through this journey of the disease. So why an ADRD public health program? Well, in order for it to become a public health issue, which Alzheimer's disease and related dementias has not always been, there's kind of a system to that. And so it's determined that a public or an issue becomes a public health issue when the burden is large, there are ways to intervene, and the impact is major. And I'm going to relate all of these back to Idaho specific data. So the burden is large. We know that 1,389 emergency department visits per 1,000 people with dementia happened in 2018. So that's per 1,000 people with dementia. And remember, we had 27,000, I think back in 2018, we had 26,000 individuals diagnosed at that time, which is a significant number of ED visits. We know that $149 million is spent on Medicaid costs and $607 million on Medicare costs. These are specific to 2020 dollars. The thing that I want to point out that is so significant today, since I'm talking to fellow caregivers, is that caregivers had provided $719 million of unpaid care. That's significant. And somebody needs to recognize that. And that's a big goal that we are working to do, to make sure that we as a state and we as community members recognize that significance of that contribution that you all have provided to us. The impact is major. Again, there's 27,000 Idahoans 65 years of age or older who have an Alzheimer's diagnosis, and 40,000 Idahoans are caregivers who are caring for them. The other part that's important in there with that impact is major is if those caregivers have to stop working, they're unable to contribute to community taxing. Such as, or not necessarily property tax, but employment taxes and so on. Why is that important? Because that does impact all the way down to the community level. This impacts employers. Why? Because most people who are stopping or quitting work to care for somebody with Alzheimer's or dementia are my age, 46 or older, where usually an employer has invested a lot of time and money in putting us where we are in position within the employment structure, to where it's going to cost the employer a lot more to replace us. And then of course, there's less investments to retirement. Traditionally, not always, I don't want to discredit the male caregivers in the room, but traditionally women have been the caregivers. And when a female is a caregiver, and if they're not working, they're not investing in the retirement. Why is this important? Because women traditionally have lower investments in the retirement savings that helps them care for themselves when they're older. And then unfortunately, if they don't have those dollars, then we as the state need to pick up and help support those individuals. There are ways to intervene. As I had mentioned previously, 40% of dementia cases could be delayed through a public health approach. Maybe we could be looking at reduction of concussions, whether it's playing sports safer. Maybe it's choosing to wear a helmet, even though we don't have helmet laws after the age of 18 in Idaho. Maybe it's making sure that we reduce our alcohol consumption, or that we quit smoking, because we know if the lungs can't accept oxygen, the brain is not getting oxygen of which it feeds upon, and so on. There's a bunch of public health approaches that we can work on. Those ED visits that I mentioned earlier, 1 in 4 are preventable, which hits upon the next one, of the readmission rates for our persons with Alzheimer's and dementia. Our individuals who have that Alzheimer's disease or related dementias, as Dr. Trump had mentioned, they have, many of them have a chronic illness as well, or a comorbidity, or a pre-existing condition before they had diagnoses of ADRD. But when they can no longer manage their medications or their treatment for that pre-existing condition or chronic illness, then that's when they're going to be admitted or readmitted into the ED. And that's something we can work on. We know that caregivers who are caring for someone also have chronic health issues, and many of them are dealing with depression. And so how can we help support them to make them as strong as possible to provide the care that they want to, which in turn helps us as a community and as a state. So what we were tasked with here in Idaho is we needed to convene a statewide alliance, of which we did as of last November. We started the statewide alliance. The meetings are held virtually. You are all welcome to join in and participate. It is not an exclusive alliance. We want to make sure it is a very inclusive alliance that includes persons who have a diagnosis, their caregivers, everyone. We want a good representation of Idahoans. Those alliance members are helping us guide the activities and the agenda that we use as we move forward in addressing Alzheimer's disease and dementia. These alliance members also help inform the trials that you all have been experiencing, help us inform us so that way we know what we really need to work on, because at times it is hard to get into the community. So we are looking for those voices of the community. We are also tasked with utilizing data. It's very important that we use data to help address Alzheimer's disease and related dementias in Idaho. And at this point, we know that we do have some data, but we do know and realize we have a lot of gaps in data here in Idaho. And that data, why is that important? Because that helps us really focus and know where to put our resources, and how to prepare for our future, as well as address the individuals who have ADRD today. We're building off of existing public health program, as I mentioned previously. Maybe we can start working on campaigns. If you're working on a healthy heart, you're working on your healthy brain. They coincide. And making sure, taking care of your lungs is taking care of your brain, and so on. We want to expand ADRD awareness so that people understand it and understand the benefits of early detection, and realize that Alzheimer's disease or dementia is not, or Alzheimer's disease and dementia is not a normal cause from aging. And so Lisa will get into this a little bit more because I fumble upon that, but it's not a normal part of aging. And so when mom or grandma or grandpa are all of a sudden starting to forget things a lot and so on, there is a reduction in or the ability to forget more. That is a normal process. But when it gets to where it's interfering with a person's activities, daily activities, and so that is not a normal part of aging. And we need people to understand that there are those benefits of early detection and or getting a diagnosis at that time, so that the person who has the diagnosis can participate in their life choices and decision making for the rest of their life. We also were tasked with developing a collaborative system. So one of the big tasks that we're responsible for on the state level is making sure that we collect all the information and understand what all of you are doing across the state of Idaho, so that we can learn and so that we can share information and see how we can maximize those efforts. So why is this good for Idahoans, this program that we've created and the state you all have invested in? Because we're helping Idaho keep brains on mind. What does that mean? We want people to remember healthy heart, healthy brain. Think about the brain. We've got to protect the brain. And we want not just you as community members, but policy members or creators to also keep brains on mind. We want educators to keep brains on mind. We want healthcare providers to keep their brains on mind, which is very important. Again, this is also good for Idahoans because we're trying to create that centralized point of information so that we can help you navigate the system that is already frustrating and exhausting enough. And another part of this is that this program is not being built because we know everything and this is just how it should be built. We are here to listen to you, and we really are taking what all of you have to say in as we work together collaboratively with all of our stakeholders and alliance to build this program statewide. And I want to leave you just with this, that if you have not been touched by Alzheimer's disease or related dementia, either as a patient or a caregiver, chances are you will be. And we want to make sure that you are equipped with navigating that system. I do want to take a moment just to brag just a moment. As I had mentioned, we just had launched in July, this program. Our steering committee was launched in August, and then the alliance, the statewide alliance, was launched in November. We did finally get our web page up, which is super exciting, which you can scroll through. And then if you scroll all the way down, which I can't on here because I just took a screenshot, there is a button that says join the alliance. And so you can, or get more information on the alliance. And so you can go to that specific page as well and get more information. And then of course, there's contact information to reach out to me and the rest of the ADRD team. And so with that, I'm going to turn it over to Lisa so that she can introduce or talk more about Alzheimer's disease across the state and what's going on in the country.
Thank you, Tiffany. If you could flip to the next one. Okay, this is just for those of you that don't know, the Alzheimer's Association, we're a critical component of getting to where we have our first survivor of Alzheimer's disease, is to continue with global research and our efforts, and I'll be talking about the policy level of that, and our efforts to help reduce risk reduction and doing our best to make sure that there's quality care and support throughout Idaho. Next one, please. Okay, so I just wanted to just really quickly, in case you're not aware of the differences between Alzheimer's and dementia. So dementia describes a group of symptoms associated with a decline in memory, reasoning, or other thinking skills that we have. Many different types of dementia exist, and many conditions can cause it. Alzheimer's is the most common cause of dementia, accounting for 60 to 80% of dementia cases. Alzheimer's is a degenerative brain disease that is caused by complex brain changes following cell damage. It leads to dementia symptoms that gradually worsen over time. The most common early symptom of Alzheimer's is trouble remembering new information because the disease typically impacts the part of the brain associated with learning first. Although we know that the greatest risk for Alzheimer's is and will probably continue to be increasing age, the disease is not a normal part of aging, as Tiffany had said. And though most Americans with Alzheimer's are 65 and older, approximately 200,000 Americans under the age of 65 are living with younger onset Alzheimer's disease. Okay, next. So 1 in 3 seniors dies with Alzheimer's or another dementia. It kills more than breast cancer and prostate cancer combined. And although deaths from other major causes have decreased significantly over the years, official records indicate that deaths from Alzheimer's disease have increased significantly. Next. More than 11 million Americans provide unpaid care for people with Alzheimer's or other dementias at an estimated 15.3 billion hours of care, valued at nearly 257 billion. 83% of the help provided to older adults in the United States comes from family members, friends, or other unpaid caregivers. Nearly half of all caregivers who provide help to older adults do so for someone living with Alzheimer's or another dementia. Okay, next. So after that little short introduction, I want to talk about the state landscape. Tiffany has done a fantastic presentation, bringing you up to date on what has been transpiring over the past 2 years to get us to the point that we are at in the state. And I'd like to quickly address the overarching goals of the Alzheimer's Association on a state level. This is what pushes our policy initiatives and our collaborative working relationships with state agencies, associations, and community partners. Okay, next. There are 4 national state priorities that align and overlap with the Healthy Brain Initiative that the CDC has put out. These goals drive our work and lobbying efforts throughout the year. The first is public awareness and detection, assisting public health in building a comprehensive public health policy plan to include efforts to address risk reduction, early detection and diagnoses, and issues impacted by COVID-19. Goal 2 covers building a dementia-capable workforce. Workforce development continues to be quite a unifying topic among governors and state legislatures. Efforts to build a dementia care workforce must consider the impact of COVID-19 and highlighting the need for increased attention for a larger and more robust healthcare workforce. The experiences from the pandemic have also highlighted the need for increased training for long-term care staff, particularly around infection prevention and control, and increased Medicaid reimbursements must be made across the board. Next, please. Goal 3 and 4, increase access and enhance care, quality of care in home and community-based services and residential settings. I'm combining them because there's significant overlap between Medicaid eligibility and access to long-term care services, both in the community and in the long-term care facility. A range of healthcare professionals play an important role in dementia care, including primary care physicians, geriatric physicians, neurologists, and direct care professionals. However, Idaho is experiencing a well-documented healthcare workforce shortage that could cause care for individuals living with Alzheimer's and other dementias to be at jeopardy. The US has approximately half the number of certified geriatricians it currently needs. And in Idaho, we will need an over 700% increase in geriatricians by 2025 to meet the need that will be in our state. In 2017, 20 states, including Idaho, were deemed neurology deserts due to the projected shortage of neurologists. Direct care workers who provide critical care and support to people with dementia often experience low wages, lack of training, and challenging work environments, which contribute to a high turnover and serve as an obstacle to effective recruitment and retention of care providers. Yet, by 2030, 3.4 million more direct care workers will be needed throughout the United States. Next. So here I would like you to think about any gaps and needs that you see in your work or in your community. We really would like to hear from you. And Tiffany and I both will try to respond to your concerns. And it actually helps to shape and guide our work as we move forward. So please email us. If you don't want to do it in the chat feature, if it's too long, just take down our email addresses. But I really want you to think as we're going through this, where you see those gaps and needs and where we can help. Okay, next. All right, federal landscape. Our policy priorities at the federal level, we have many, but there are 4 that we are really honing in and targeting this year. And I'm going to talk about each of these individually. Next. Next. Okay, so our first one's going to be appropriations, everybody's favorite. Next slide, please. The escalating Alzheimer's epidemic has had profound implication for government budgets, as you saw in Tiffany's presentation. Alzheimer's is one of the most expensive diseases in our nation, costing more than heart disease and cancer. In 2021, caring for people with Alzheimer's and other dementias will cost the United States an estimated $355 billion. Cumulatively, between 2021 and 2050, it will cost $20 trillion in 2021 dollars, 2/3 of which will be borne by Medicare and Medicaid. That's an insane amount of money. 1 in every $5 of Medicare spending is spent on people with Alzheimer's and other dementia. Despite the recent increased investment in Alzheimer's research, funding still falls short of the need. For fiscal year 2021, Congress provided an additional $300 million in Alzheimer's research funding to the National Institutes of Health. With this increase, along with previous research investments, the National Institutes of Health spending on Alzheimer's research is expected to total $3.1 billion. However, this is still short of the total funding scientists and the Federal Alzheimer's Advisory Council have indicated is necessary for continued progress. The National Alzheimer's Plan established a goal of developing preventions and effective treatments for Alzheimer's by 2025. In order to achieve this, the National Institutes of Health's Alzheimer's bypass budget, which the National Institutes of Health scientists say they need, calls for an additional $289 million in Alzheimer's research funding for the fiscal year 2022. This increase will allow National Institutes of Health to accelerate investment in collaborations that speed discovery, groundbreaking prevention trials, and testing of new therapeutics. And you can see by this chart how the funding from 2011 to now has just gone up and up. Research is so important and vital. Next, please. Part of the appropriations is the BOLD infrastructure for Alzheimer's. If you don't know this, you should know this. Idaho did receive a grant under the BOLD Act. With the congressional funding, the CDC is able to fund 3 Alzheimer's Centers of Excellence, which will expand and promote innovative and effective Alzheimer's interventions. Provided grants to 16 local and tribal public health departments, including Idaho, to implement interventions, including those in the public health roadmap. And it also helps to increase the analysis and timely reporting of data on cognitive decline and caregiving to inform future public health actions. So we'd like, we will be asking and have been asking Congress to fully fund the BOLD Act. Next, please. Okay, next we'll talk about the ENACT Act. Alzheimer's and other dementia disproportionately affect older Black and Hispanic Americans compared to older white. Black Americans are twice as likely. Oh, could you go to the next slide? Sorry. There you go. Black Americans are twice as likely to develop Alzheimer's, and Hispanic Americans are 1.5 times more likely to develop the disease. However, much of the Alzheimer's research to date has not included sufficient numbers of Black, Hispanic, Asian Americans, Pacific Islanders, and Native Americans to be representative of the US population. The underrepresentation of these population not only hinders the ability of researchers to understand these health disparities, it also restricts their knowledge of how an approved therapy or diagnostic may affect the population most likely to need and use the drug. There is an urgent need for current and future research to include increased numbers of Black, Hispanic, Asian Americans, Pacific Islanders, and Native Americans in clinical trials to ensure everyone benefits from the advances in Alzheimer's science. Next, please. There we go. The ENACT Act would decrease the participation. Oh, excuse me. The ENACT Act would increase the participation of underrepresented populations in Alzheimer's and other dementia clinical trials by expanding education and outreach into those populations, encouraging the diversity of clinical trial staff, and reducing the participation burden, among other priorities. Next, please. Okay, we'll talk about the Comprehensive Care for Alzheimer's Act. Next, please. This is just kind of a overarching services that most people living with Alzheimer's need. Pretty basic, doctor's visits, cognitive assessments, care planning, adult day services, medications, etc. Next, please. This shows you the services that are covered by Medicare. So adult day services are not covered, caregiver assessments, access to providers, community-based, these are things that services needed by people living with Alzheimer's that are covered by Medicare. Next. So what the Comprehensive Care for Alzheimer's Act would ask the Centers for Medicare and Medicaid Intervention to test a better payment structure for dementia care management. Next, please. The model would provide services such as the development of a dementia care plan, care coordination and navigation, and caregiver education and support. It would also ensure patients have access to an interdisciplinary team of providers with dementia care expertise, and would reimburse providers through a capited payment and an incentive payment based on performance. Next, please. So this is just kind of a diagram of what the system looks like right now. You can see everything's kind of all over the place. And the patient and the caregiver are trying to go down all these many different roads on their own. Next, please. This is what it would look like with a DCM model. A little more streamlined out and in. So that's what we're hoping for. All right, next, please. I believe this is our last act, the Alzheimer's Caregiver Support Act. Next, please. Alzheimer's and dementia caregivers often provide care that is much more extensive and intimate than that of other caregivers. Nearly 80% of older adults with dementia receive help with the daily personal care activities such as bathing, dressing, grooming, or eating. By contrast, only 20% of older adults without dementia need help with those activities. 1 in 3 of Alzheimer's caregivers provide help bathing, showering, feeding, getting to and from the toilet, and at a higher percentage than caregivers of other older adults. Nearly 2/3 of dementia caregivers expect to continue to provide care for the next 5 years, compared with less than half of other caregivers. Next, please. Although caregiving is often rewarding, the intense responsibilities often take a toll on the caregiver. More than half of dementia caregivers report having no experience performing medical and nursing related tasks. In addition, dementia caregivers are twice as likely as other caregivers to report that these tasks are difficult. Nearly 75% of Alzheimer's and dementia caregivers are concerned about maintaining their own health since becoming a caregiver. More than 1 in 3 dementia caregivers say their health has gotten worse due to their care responsibilities, and more than 1/4 of dementia caregivers delay or do not do things that they should be doing to maintain their own health. And I'm sure that's something all of us can relate to. I know in my own experience with not only my father, but my mother, just to back up, if you weren't here at the beginning, my father passed away from Alzheimer's 6 years ago, and my mother passed away from complications of a lung disease last October. We were my mom's caregivers for the last 4 months of her life, and trying to juggle working full time, caring for my mom, being a grandmother, a mother, a wife, was very difficult. I would never have changed that time I had with my father or my mother, but it's okay to say that it was very difficult. Next, please. In 2020, family members and friends of individuals living with dementia provided unpaid care valued at $257 billion. Just to remind you again, on average, each dementia caregiver spends about 20% more time providing care than a dementia caregiver did a decade ago. This is the equivalent of nearly 6 more full work weeks of unpaid care every week. So this Caregiver Support Act, just in a nutshell, would provide grants to organizations so they can expand training and support services for families and unpaid caregivers of individuals living with Alzheimer's disease and related dementia. All right, next, please. I want to let you know that we have at the Alzheimer's Association, there is help and support available. We have access to a lot of support. We have support groups. You call and we will find a way to help you. Our helpline is manned by master level clinicians 24/7 every day of the year. So if you need help and you call this number, they will figure out where you need to go and how to help you. This is the case even if you have a loved one who lives in another state. You call that number and they will figure out how to get that loved one help. That's what they do. So remember this phone number. If you don't remember that, you can always email me, email Tiffany. We can give that information out. And again, I want to say, if you are interested in ever helping with advocacy efforts, being one of those advocates that Tiffany talked about earlier, that help push through getting that report done, that help push through getting funding for surveys on, specific to cognitive decline and caregiving, getting that funding through the governor's office so that we have what is shaping up to be a very robust public health, Alzheimer's and related dementia program in health and welfare, thanks to Tiffany. It was because of advocates that all happened. And it's because of advocates that all of the policy changes can happen to help people on the ground. We haven't had a lot done in our state. And we haven't had a real coordinated effort, but we are at the point that we do. And now is the time. We've got a lot of initiatives going through the state legislature right now that will help individuals with Alzheimer's disease or another dementia, and will help their caregivers and family members. So please, if you want to be involved in any way, reach out and let us know. And I'm going with that. Thank you for listening.